And these are the updates coming in from the top government sources, which indicate that right now in most of the metropolitan cities, about 90 to 95% cases which are being reported are of the Omicron variant. This is the new variant, which is vastly has replaced the Delta variant, at least as far as the big cities are concerned. And it is not present right now significantly in the pediatric population, in the children yet. That's the bit of news coming in. Runjhun continues to stay with us on the broadcast and get us all the perspective on this important story. Runjhun, tell us more about this. Omicron is fast replacing the Delta variant. This is likely to be the trend in other parts of the country as well, once this wave is past the big metropolitan cities.
Yes, in fact, in the coming few days from the metropolitan cities, where the prevalence of the Omicron variant is about 90 to 90%, is what I've been given to understand from my sources in the government. Also, that will in fact be taken over in other parts of the country as well very soon. For now, the hospitalization, the need of oxygen also that is being pointed out is not as much as we've seen in the second wave. In fact, there was a letter that was written by the Health Secretary Rajesh Bhushan to all states yesterday, essentially telling them that as compared to the second wave, where the hospitalizations of the active cases were seen to be around 20 to 23%, but that in this particular wave, in this particular surge, or how he calls it, has been reduced to 5 to 10%. So there's a downfall there. But having said that, the health secretary also pointing out that it's very important that states monitor private hospitals, make sure that they don't overcharge. Anusha, this is something, remember, we saw in 2020 as well as 2021. Also, let me point out that what the government wants at this point is augmentation of healthcare workers. So the suggestion which is coming in from the Union Health Ministry, from the Health Secretary Rajesh Bhushan, is that states must rope in MBBS students as well as retired medical professionals, at least to guide or when it comes to teleservices, telemedicine. So those MBBS students also plan to be roped in as far as the surge, this particular surge, is concerned.
All right, Ranjan Sharma getting us all the details.